Good afternoon. I'm Rick Christie, Executive Editor of the Palm Beach Post. Thanks for joining us today. Few issues have dominated the news the past few weeks as much as the long-awaited distribution of the COVID-19 vaccine. The issue has been especially poignant in Palm Beach County, home to tens of thousands of eligible seniors over the age of 65. The botched rollout of the vaccine in our county, due to problems on the federal, state, and local level, has raised the ire of anxious seniors from Boca to Wellington to Jupiter. It has also raised numerous questions. So today, the Post will try to address these COVID vaccine distribution issues with our veteran staff reporters, Jane Musgrave. Hi, Jane.
Hi, Rick.
And Hannah Morse.
Hey, Rick.
Hey, Hannah. Now, both of these guys have been covering the coronavirus pandemic since it officially began in March. And I can't think of any journalist more qualified to discuss the latest on how the vaccine is being distributed in Palm Beach County, as well as where residents who qualify can get the shot. Now, let me remind those folks who are watching that this is meant to be participatory. So we want to hear your questions and hopefully get them answered. Just leave it in the comments section. Now, and again, thanks for being here. So Jane, let me start with you. How would you describe the state of the pandemic in Palm Beach County? And why do you think that is?
I think with the promise of the vaccine, I think that, most healthcare experts are concerned because I think that a lot of people think it's happy days are here again. Woohoo, the pandemic is over, and it is far from over. And in fact, in the last couple of weeks, the numbers in Palm Beach County, throughout the state and the country, have skyrocketed. I mean, we're averaging in the last week, over 100,000 cases. Our positivity rate is over 10%, which is double what healthcare experts say it should be. And deaths are rising, even though researchers say, especially in South Florida, the deaths are severely underreported. So I think that, a lot of it is just people are tired of it. And maybe they think at this point they could just roll the dice.
So this is what we're thinking in terms of, I guess, what we've heard of pandemic fatigue. Is that what you're talking about?
Exactly.
Okay. So, well, before I get to Hannah, what would you say was the latest on how the vaccine is being distributed? Kind of give us an update on where we are with that.
Well, it's been chaotic to say the least, and I feel so sorry for all these senior citizens that are desperately trying to get appointments. And it seems like, as one reader told me yesterday, that it just seems like it's the gang that can't shoot straight. Everything the health department tries to do to reach out to the community to figure out an appointment system that works seems to, have glitches. First it was that the phone lines didn't work, then it was the email address didn't send confirmations. Then when they tried to send confirmations, that was a problem. They apparently tried to roll out an online appointment system, and that didn't work. But to many, that kind of begs the question that a lot of seniors, particularly those over probably 80 and 90, some of them don't even have email addresses. They're not particularly internet savvy, some of them. And that's really their only option at this point because the phone lines are just jammed and there's no way to get through. So, they're resourceful. They have created incredible underground networks to try and find out where appointments are being given. But it has not been, I don't think we would want to emulate.
So Hannah, let me ask you, because I think we've heard Dr. Alina Alonso, the director of the Palm Beach County Health Department, say and actually emphasized last week to state lawmakers about the amount of vaccine. Does the county have enough vaccine doses to inoculate those in the first wave?
So the county should eventually get enough to inoculate those in the first wave. They've been getting these doses in shipments, 20-something thousand one week, 4,000 another week. So it's been varying week to week, and they're unsure how much they'll be getting one week to the next. And so Dr. Arlene Alonso, the health director at the county health department, has said that the thousands of seniors who have signed up to get an appointment, it might take weeks to months to actually fulfill those appointments.
Wow.
As of yesterday, more than 646,000 people in Florida had received the first dose. In Palm Beach County, that was 51,000, and only 1,200 people had gotten the second dose in Palm Beach County.
Now, which vaccine are they administering here, Hannah? Can you tell? Is it Pfizer or Moderna? Which one?
Some counties are getting both, but Palm Beach County right now is administering the Moderna vaccine.
No, okay. Now I got a question from boy, I'm going to try to keep up. Boy, we're getting a lot of questions here.
Add something really quick, just to show the math problem. There's 400,000 people over the age of 65 in Palm Beach County, and when you're getting 4,000 doses a week, that is not going very far.
Oh, good point. Good point. So, Jane, let's stick with you on this because this is from a Lee McLaughlin. I'm 72 and trying to get vaccine for at least 3 weeks. Text go unanswered, phones cut off or go to voicemail and no answer. Notifications on television and emails fill up before they open. What do we say to Lee? What can we say to Lee?
Sadly, that is just what the rollout is. I mean, I have talked to dozens of seniors who are having the exact same experience, and there is just nowhere to send them. I mean, the only way of contacting, getting in line is through that email to the health department, which they say, they're honoring the queue. So if you, for instance, had you sent in your request on December 30th, they will get to you, but it's just, they don't have the supplies.
Wow. And so what would be your, I guess your suggestion, your advice be just be patient, keep calling, keep emailing. What would you say to that?
That's really their only option. I know that there has been people have tried unsuccessfully or some successfully. Like they did a pod is what they're calling them, a closed pod at Kings Point. And the word got out in South County that they would have extra doses. So hundreds of seniors showed up at the end of the day, but very few, if any, got vaccinated. So, I mean, those kind of efforts, I just think are, counterproductive at best. And nobody is getting a vaccine without an appointment. Dr. Alonso has made that very clear. Don't show up at the health department expecting to get a vaccine. The hospitals say they do not have their clinics set up yet. The only public entities that are giving vaccines right now is the health department and the Palm Beach County Healthcare District, which is assisting the health department.
Now, what about fire departments? Because I mean, you heard about the town of Palm Beach, and let me ask Hannah this, because one of the things that seems to be we don't know. I'm not sure, and I think a number of people out there probably are not sure just who is distributing vaccine. Jane, as you just mentioned, the health department, the healthcare district. We know hospitals, CVS, and Walgreens.
No.
Okay, go ahead.
CVS and Walgreens only have contracts to do nursing homes.
Nursing homes, right.
Publix is doing it elsewhere in the state, but locally, Publix are not doing it. Today, Dr. Alonso distributed less than 200 vaccines to municipal fire departments. Okay. And not surprisingly, those vaccines were snapped up within seconds, probably. Okay. I'm not exactly sure why that was done, but I guess, she had made a promise that there would be some municipal distribution. So I guess it was an effort to make good on that promise.
Yeah, and I got
that is, as anybody I'm sure that tried to get through to Delray Fire Department, Boca Fire Department, Palm Beach County, Palm Beach Gardens Fire Department today can tell you, it was probably more frustration than it was worth.
Yeah, we heard from one of the people watching, Gail Rittenauer Quinn, I believe. Only 200 vaccines at Delray Fire Department this morning available to register at 10 a.m. I tried at 10 a.m. and the site was overloaded.
Yeah.
200 vaccines. This is insane. I've been in the house for 43 weeks. When will more vaccines be available? Do you guys know, Hannah, Jane? Can you tell her when more will be available?
No, and that frustration is just evident to how this rollout has been. It's the announcement of these availability of these vaccines for city residents has been announced with little notice and then snapped up, like Jane said, almost immediately. So it's tough to say when we can get more. We know that Publix might be in Palm Beach County, maybe soon giving out those vaccines, but time will only tell when that will exactly happen.
Well, let's talk about also, I'm going to get to, vaccine sites. So Hannah, why don't you talk about another one of the governor's initiatives, Governor Ron DeSantis' initiatives this week, I think, and that has to do with Black churches. And can you tell us where Palm Beach County may be in that mix in terms of distribution or sites?
Right. So the governor announced that he wanted to partner, or the state would partner with community centers and churches to really target communities with majority Black populations. And in Palm Beach County, through the help of state legislators, that will be happening at Tabernacle in West Palm Beach. And on Sunday, there's another distribution happening. The site had to be relocated to Wells Recreation, but all of those appointments have been filled up just to really target those communities that might not have easy access to the vaccine otherwise.
Boy. Well, Jane, let me go back to you so we can get some more basics here. Who is eligible for the vaccine right now?
Healthcare workers, paramedics, first responders, but not law enforcement.
Not law enforcement.
Nursing home residents, and those 65 and older.
Okay. And that's a pretty good amount of people in Palm Beach County from what you were saying earlier, that at least just 65 and older alone is more than 400,000 people. Exactly.
And there's tens of thousands of healthcare workers on top of that.
Wow. Okay. Well, here's something that other people keep asking. Can people come from out of state or the county and get a shot here?
Well, Governor DeSantis this week, that became kind of the clause celeb, because I think there was some press about Florida becoming the vaccination tourist capital of the country. And he gave a pretty emphatic no to the idea that Florida was going to be vaccinating tourists. So I guess they could make people show ID to prove that they actually live in Florida before they're vaccinated. But I mean, the problem that the governor pointed out was that we have so many snowbirds. And I know that's caused some friction. I have gotten emails from some seniors. But if they live here part-time of the year, what the governor has said is if they're moving around our community, we want to get them vaccinated. Okay. Our 65 years of, they would become a burden on our hospitals. They would, they need to get vaccinated, even if they're only part-time residents.
Okay. And how much does the shot cost?
They're free.
They're free. Okay. I asked that because I thought there was a story this morning I was reading, not one of yours, obviously, but that there are some places that are charging like an administration fee or something like that, but that's not happening in Palm Beach County.
I have heard of no private distribution sites. I don't know where people would be getting a hold of them. But the state attorney did warn of scams. He said they had not seen them in Palm Beach County, but he did warn people to be on the lookout for scams. Like if you get emails or phone calls from people offering to give you the vaccines for $150, it's a scam. There should be no charge. They're free. I think there's allowed like a $15 administrative charge. I think is what you said.
Yeah, something like that.
Yeah, I think there's administrative charge, but that's it.
Yeah, okay. Are there any side effects so far? Have we heard about any side effects in Palm Beach County? Either of you guys from so far from the vaccine, people getting the vaccine? None?
I have not heard of any. Go ahead, Hannah.
Yeah, same. I haven't heard of any major side effects. Any side effects should be minor, pain from the injection site or maybe a fever or anything like that, like anything you would typically get when you get like the flu vaccine or anything.
Okay. And Jane, you haven't heard of any either here in Palm Beach County?
No. I think Dr. Alonso said, it was just the typical, side effects that you would expect with any kind of shot.
Okay. Have folks already started getting the second dose here?
About 1,200 have gotten both the first and the second shot.
Okay. All right. And I'm trying to remember. It's like a 21-day wait or a 28-day wait between the two?
Yeah, it's like 3 to 4 weeks, depending on which vaccine you get.
Okay. All right. So, okay. Hannah, do you know who is next in line to get the shots, or law enforcement next, or in the next group? Because I know we're having a hard time getting through group 1A. But do we know who the next group is? Who's in the next group?
Right. I would imagine essential workers who are out in the community more than other people might be. But who that might be next, when that might happen, the general public, that could be months and months away.
Okay. Now here's a familiar name. Janita Cherubino is asking, can you find out where you are in the queue when you I guess when you make a phone call and you're trying to make an appointment or send an email? Is there any way to find out where you are in the queue?
The only yesterday, the health department said that they had begun calling people for appointments that had submitted their emails on December 30th. So that might give you some idea where you stand in the line.
Okay.
But as far as being able to say that you're number, 10,152, I know of no way to say that. I have not heard people say, that's not included on the email.
Right.
That they're sending people. So the only way you can gauge it is by that date.
Okay.
That's all I can tell you.
Oh, wow. Do we have any idea when? Well, I was going to say when we think the next group will start getting vaccines, but I imagine that's kind of hard to say given the fact we've had a trouble with the first group and everything. So, but what about, one group that's actually been getting a lot more discussion this week is teachers. Are we hearing anything from Dr. Alonso and the health department regarding teachers, Hannah?
Well, there's been a big push from people across the state to appeal to the governor to make teachers move to the front of the line since they'll be in front of students. Recently, the Palm Beach County Superintendent, Dr. Donald Fenoy, had made such a similar appeal to get teachers the vaccine.
Oh, okay. Let me see.
But I would like to add, Governor DeSantis has shown he's been asked that question repeatedly, and he has not shown a real strong interest in
moving teachers up.
Or anybody for that matter. He has mentioned law enforcement. That's the only people that I've heard him give a shout out by name. But his kind of mantra has been that he doesn't even like the whole term essential workers because he thinks everybody does essential work. So who might be, or whether there might be a second group before it's just a free for all is unclear. I mean, he has given no indication one way or another that I know of.
Okay.
About who might be in that second group.
Well, let me keep going here, Jane, because I think you answered this question earlier, but I just wanted to be sure, Mr. Dave Tetrault, if you are a seasonal resident, can you still get the vaccine here? And I think you touched on that earlier.
Yes, if you have a permanent or a semi-permanent home in Palm Beach County, if you have evidence that you live in Palm Beach County or in Florida, as I understand it, snowbirds are being allowed to get the vaccine.
Okay.
But the health department has also said that there's no residency requirement at all. So you don't.
There is no residency requirement.
Unless you're like today, the fire departments that were taking vaccine appointments, you had to show if you're a resident of Palm Beach Gardens or a resident of Boca Raton. But for that.
Well, you're right. And even though DeSantis said that the other day, Dr. Alonso made it clear that she would wait for additional guidance on, whether or not she could vaccinate tourists. So whether or not that guidance came down from Tallahassee is unclear.
Okay, so it's some more basics here. Where do you get an appointment for a shot? You go to we've already talked about that. That's the county. That's either through
The email.
Through the email or phone, or just don't even bother with the phone?
Yeah, just the email, CAB50 feedback@flhealth.gov is.
Oh my God.
Yeah, it's very user friendly. Can we put that up? Can we?
I don't know. I'm going to have to see if our tech folks can actually do that. That's actually a good point. Actually, where we should put that in the Facebook live comments area. Go ahead and put that email up there, as well as any phone number that people should be calling. That's a good suggestion, Jane.
Okay.
So where's the phone? Was it there? Okay. So they're also asking who is responsible for setting up where you can get a shot, because people are asking, like, where can I go to get a vaccine shot? But don't they have to have an appointment first? You can't just show up, because it's not first come, first serve here, right, Hannah?
Right. You shouldn't be going anywhere except to your computer to be making that appointment. And you can only go somewhere physically when you do have that appointment. Okay.
And they have not turned 15 ballpark into like a vaccine place. It's still just for testing.
Right. The county is still working on its mass vaccination plan, which would include things like a drive-through vaccine site or mobile van units going out to underserved populations, but that hasn't come to fruition just yet.
Okay, all right, and then let me see. Hold on, we've got some more, a lot more questions here, and I'm trying to keep track of them. Okay. From Samantha Einhorn Trinemeyer, I believe, I'm sorry, I hope I didn't mess up your name. I'm in healthcare and high risk. I cannot find any available vaccines. Will there be any more coming to Palm Beach County soon? Either of you guys, can you?
Yeah, they're supposed to get weekly shipments. The problem is that it's not reliable. I mean, they got 20,000 the first shipment, then they got 4,000, then they got 4,500, so it varies dramatically. What they're hoping is that the supply chain loosens up. And so instead of getting 4,000 like they did this week, they'll get 20,000 like they got several weeks ago. I guess we'll find out, possibly tomorrow, or, certainly by Monday. I guess they get the shipments on Monday. But yes, additional vaccines will be coming.
Always coming. We just don't know how. But you just don't know how many for sure.
Right. And I got the idea from even at the state level, they don't get any kind of warning. They're just told this is your allocation for the week. And then they call up trying to get more, and all the other states are calling trying to get more. So, it could relax the jam, but it comes with its own set of problems. There is talk that they might be not having to hold back the second vaccine. Right now they have to hold back enough so the people that got the first vaccine get the second vaccine. So if you got 10 people vaccinated, you have to have 10 that you're holding back. Well, the federal government said just give as many vaccines as you can, and the second dose will be available. Okay. But it's risky. I think some people worry, will the second dose become available? And if it doesn't, then I took a shot for nothing, because I'll have to be vaccinated all over again.
Oh, wow.
That would really open supplies if they were able to do that.
And let me answer. Let me see if you guys can answer. Flint Mike Key. He's further up real quick because he asked, and Jane, I heard you mention December 30th earlier, but he says, I sent my info to the Palm Beach County Health email on December 31st. When will I get an appointment, roughly?
I couldn't even hazard a guess. All I know is that they said they had already started booking people who sent the request in on the 30th. Okay. So, did 10 people send in a request on the 30th? Did 20,000 send in their request on the 30th? The queue apparently consists of 100,000 people. So,
excuse me, say that again.
They have 100,000 people on the waiting list. That's what Dr. Alonso said the other day.
Wow. Okay. All right. And they are currently inoculating roughly how many people a day would you say?
They say 500.
And 100,000 are in the queue.
Exactly. That's the math problem.
Yeah.
That's why people can't get appointments.
Yeah. That's wow. Would you guys, Hannah, would you recommend somebody who lives here, say someone who has an elderly parent and who may have COPD, which is a respiratory issue, would you recommend that they try to go to another county like Broward, who may be a little bit better at doing this? Or would you say, no, stay patient, stay here?
Well, you could always put your name in the queue in Palm Beach County and wait if you get an appointment. Some Palm Beach County residents have been having better luck looking outside of Palm Beach County and Martin County and Miami-Dade. But those appointments outside of the county are filling up just as quickly.
Okay. Have you heard stories of people like driving hours, to go to other counties to try to get the vaccine? Jane, I see you nodding your head.
Yeah, I think Glades County is. I've heard even as far away as Alachua County. No, I think people are just really desperate. I think they are doing anything they can to get these vaccines. And I know Indian River County, there was some interest in. I think Cleveland Clinic had some available. People went up there. Obviously, people have gone down to Miami. I think people are driving long distances.
Okay. Have either of you heard anything about the state setting up some kind of statewide registry, maybe for COVID appointment to be administered by the state? Any rumblings? I haven't heard that before. Have you guys heard anything? Hannah?
The state emergency department director, Jared Moskowitz, said that they are working on a statewide appointment system, that it could be rolled out within a few weeks, but it's still a waiting game.
Still.
When they crashed, when they tested it last week, right? Is that the one that Dr. Alonso was talking about, that it crashed? I think it is.
Oh.
Online appointment system.
Oh my goodness, really? Because
Yeah.
I know she was talking about some system that crashed. You think that was it, possibly?
I'm pretty sure. Because that's what their goal is. They want to have a statewide appointment system. And they thought they were close, and then they tested it out and it crashed. So it was back to the drawing board.
Boy. Is there, has Dr. Alonso talked at all about possibly changing to a first come, first serve system rather than the appointment system that the county has now? Or would that, in your opinion, I don't want you to go too far in opinion here, but that would just be worse?
I think that would be chaos. I saw those pictures from Kings Point with those people standing outside just desperate to get whatever scraps of vaccines were available. No, I don't think. She has made it clear she does not want, especially seniors, standing in line in wheelchairs and walkers, or even healthy people in the standing in the heat just waiting for hours. I don't think we're going to see that, and I think that we don't ever want to see that.
Okay. Well, let me ask what probably is an obvious question, but people keep asking it here. Hannah, is the what did they say? Is the email is it working correctly? Because after we put it up, people were like, okay, but what was this? Some people I know have gotten a response from that email, but many have not, which you guys already know. So is it even working correctly?
That is a good question. It has had many glitches. The health department has said that while the people initially would have gotten an auto reply response to confirm that their email was received, it was so overloaded that people just probably aren't going to get that message. But if you send it to the right email address and you didn't get a bounce back message with maybe you put the wrong 0 or something, you should be in line. That's what they're saying.
Oh boy. Hold on a second here, because people keep asking the same stuff over and over again because I guess they just aren't satisfied, with the answers. Has Dr. Alonso said when has she even tried to hazard a guess now as to when we might reach herd immunity? Has she even tried to hazard a guess on that, Hannah?
Later this year, definitely. I know that public health officials like Dr. Anthony Fauci have said 60 to 70%, but he was moving closer to 90% because of just how transmissible this disease is. Just to put it in reality terms. But it all really depends still on the wide acceptance of the vaccine, how many people are willing to take it, and its availability, obviously.
Okay. Oh boy. Hold on a second here. And also need that we should answer this. Once someone gets the shot, can they shed their mask, or should they still keep their mask on, Jane? Should they still wear it?
Oh, I've heard that some people are using that as an excuse not to wear a mask, but they cannot use that as an excuse not to wear a mask, because even after you've been vaccinated, you have to wear a mask, because I guess the science is out on whether or not you can still be a carrier. So people have to wear masks even afterwards.
Even afterwards. Okay. I had heard that myself and everything. So I think we've covered pretty much everything, but I did want to ask you guys, what's the best thing for people to do, for someone to do right now? Hannah, you go first.
I hate to say it, but it's been repeated far and wide. Be patient. Just sign up if you haven't already. There may be more options available soon as plans expand to Publix or more vaccines are available, so we can do this mass vaccination plans. But that's really it, unless you want to reach out to your state legislators to voice your frustrations. Maybe that can get them to tell the governor to bring more vaccines locally. But
And well, while I got you and everything, let me go back to this question someone asked early on, and I kind of skipped over it because I was trying to get to other stuff. Can you explain what happened with, and maybe Jane can jump in here too. Can you explain what happened with regard to the town of Palm Beach in terms of them getting how many doses? 1,000? 1,000 doses?
Yes, Dr. Alonso has apologized for this, and it all goes back to that.
I'm sorry. Go ahead, Jane. I'm sorry.
Ready? Okay. Dr. Alonso has apologized for this, or taken responsibility for this, I guess is a better way to say it. What happened was, according to her, is the first week they got 20,000 doses. And the plan was always to use fire departments as their distribution system to, the community distribution system. So she gave 1,000 to the town of Palm Beach, and then all of a sudden they realized, whoa, hold on, we're not going to get 20,000 a week. Next week we're going to get 4,000. So this plan to distribute it to all the local fire departments to distribute to their the residents of those communities had to be put on hold. But meanwhile, Palm Beach had moved forward with their plans to schedule their vaccinations. The optics of that are beyond unfortunate.
Yeah.
And today, I guess, partially that plan was put back into effect when we saw like 100 or 200 vaccination being given to Palm Beach Garden, Delray Beach, Boca Raton, very small quantities compared to what Palm Beach got.
Oh, okay. And is there some kind of friction now with regard to the city of West Palm Beach as well in terms of doses they were supposed to be getting?
Not that I know of. I think that I don't know how many they got in this latest, what happened today. I had not heard of how many West Palm Beach had gotten. As I understand it from Dr. Alonso, all the municipalities that wanted it, these small quantities, it was given to their fire departments.
Yeah. Let me ask you this. I'm going back through a number of the questions here, and I don't know why this one is one, but Tessa Reynolds is asking, when will COVID vaccines be widely available for seniors 65 and over in Boca? We emailed for an appointment, but we're told there was a waiting list, at this time, of 120,000.
Right.
And
yeah, she's in the county. She's in the county system.
Oh, okay.
Yeah, she's in the county system.
Boy, okay. Well, let me, so I'm going to, Jane, leave you with this, with the last question, the one that I had asked Hannah. What's the best thing, if you want to add to that, what's the best thing for people to do right now?
This is just so hackneyed and awful to tell people this, because I feel so sorry for them, what they're going through. I know they desperately want that vaccine, and they desperately deserve to have that vaccine. And to tell them to relax, I don't know. I don't know that I want that to be associated with my name. But they're really, as far as I know, they're not sitting on them. They're not, they're just, the supply has not reached the demand.
Okay. All right. Well, I think we've reached the end of our, we actually have gone past our time here and everything. And I want to thank both of you guys for coming on and talking about this, answering folks' questions. There's going to be more, because from everything that you guys have told us, this isn't going to be over anytime very soon, unfortunately. But I do hope that that folks are patient, and that one of the first things that happens is that we get more vaccine distributed. I think that would be, or get more vaccines sent here to Palm Beach County. That will be one of the first steps, I guess, in trying to solve this logjam and everything that we're having. So thanks again, Hannah Morse and Jane Musgrave, for joining me today to talk about this. And folks, thank you for sitting and listening, and we answered a number of your questions to this point. And we hope to do this again, as next week. And so if you do have questions that you still want answered over that period of time, please email us. All right. Thank you very much. And you guys stay safe.